It's a controversial move that has some advocates raising their eyebrows following the province's announcement that it may consider making addiction treatment mandatory for individuals in jail, on probation, or on parole. The proposal is part of a larger justice bill that was introduced at Queen's Park Thursday, but is not yet included in the legislation itself. Health Minister Sylvia Jones says they're still determining what it could look like, how much it would cost, and what support they would need from the federal government. Jones acknowledges the complexities involved in such a decision and says the province would conduct consultations that would include experts and people with lived experience.
Look, there's no doubt that there has been an increase in the use of illegal and frankly deadly drugs in our communities and, yes, in our corrections facilities. And we need to do the work to make sure that any programs that we bring forward are actually going to help people.
The government says they're also hoping to learn from what's worked or failed in other jurisdictions in the country. Two senior government sources say Ontario is leaning towards British Columbia's model, which allows for involuntary addiction treatment for people simultaneously facing mental health challenges. Now, a medical doctor is arguing that the discussion surrounding involuntary treatment in Vancouver involves individuals who are unable to consent due to mental health issues, but that's not the case here in Ontario.
The discussion is actually completely different because they're suggesting, I think misguidedly, involuntary treatment for people who are part of the justice system. And so I think very immediately one of the challenges that they'll run into is legal.
He adds that across the country, there isn't really a precedent for involuntary treatment based solely on someone's involvement with the correctional system. Enforcing it would be a violation of human rights.
People still have human rights. People have autonomy over their bodies. And when people violate someone's autonomy over their bodies, well, we call that assault.
The proposal is still in its early stages, with the ministry expected to present a plan and other options to Cabinet by fall. Jazan Grewal, City News.